Hey everyone, Ron here from IKN. So in this video, we're going to look at how we can improve foot pronation via indirect perturbations. And all that means is that we're challenging or perturbing the maintenance of a certain behavior, foot pronation in this case, through neighboring segmental movements and muscular activations. So we're pre-positioning the foot in pronation here, and then challenging the segments and the muscles around that to see, can we maintain foot pronation as we move the neighboring segments and challenge the neighboring muscles in a certain way. It does require an understanding of what facilitates that behavior that we're trying to challenge already. So within the context of foot pronation, how will the segments and the muscles behave to facilitate that? And then we need to understand how will they behave to move us out of that foot pronated position, to challenge it, okay? So we'll go through that briefly as well. But the concept of perturbations within rehabilitation has been utilized for years and years, primarily within balance rehabilitation. So before we kind of mention that, it's important to consider that we need to have some general ability to access the behavior that we're trying to perturb before we perturb it. So within the context of balance, for example, we're not going to challenge or perturb someone's balance if they already have really poor balance. So they need to have some capacity to balance against gravity first. So let's say you have the ability to balance on one leg for 30 seconds with your eyes open. Then you can challenge that capacity via a small external perturbation, via push, for example, from a therapist, to see, can you maintain that ability to balance on one leg with your eyes open in the presence of that perturbation? Okay, or do you have to take a step? Do you fall over? We're utilizing the same thought process here, but within the context of how we can challenge local muscle and joint behavior, okay? So when it comes to challenging or perturbing foot pronation indirectly, like I said, we're pre-positioning the foot in pronation already, and then challenging the segments around that. So firstly, we need to consider what facilitates foot pronation, and we need to look at neighboring segmental behavior to understand that. So the ankle needs to be able to dorsiflex. Okay, in a closed chain scenario, that's going to occur through tibial flexion, or a flexion of the tibia over the foot segment. The calcaneus needs to evert. The first metatarsal needs to dorsiflex, and the toe needs to be able to flex, okay, to provide a lifting of that first metatarsal. Okay, those are segmental behaviors or components that facilitate foot pronation. Okay, so in order to understand how we can challenge that foot pronation, we need to understand what do we need to do to facilitate supination. Okay, and it's the opposite of what we need to do to facilitate pronation. So we need to allow for more of an extension of the tibia. Okay, an inversion of the calcaneus. Okay, a plantarflexion of the first metatarsal and an extension of the toes. Okay. But we don't need to challenge all those individual components. We can just challenge one, okay? Now, what we're going to challenge here is the ability to maintain ankle dorsiflexion and pronation, where we would naturally be trying to plantar flex the ankle, okay? So we're going to use a split squat strategy here, okay? Now, this is a strategy where we may think we're trying to load up the quads or the glutes, but we're utilizing it as a strategy to, again, challenge the maintenance of foot and ankle pronation. But before we're challenging it, we need to have some general ability to facilitate it. So it can be facilitate pronation first. Sometimes clients may be able to express pronation, but they're not able to engage with it well during multi-joint movement behavior. Okay, they're not able to manage loads very well while the foot expresses foot pronation. So we're utilizing this as a strategy to challenge it in many different ways, okay? So we're looking to see, can we decouple foot behavior from knee and hip behavior? So generally what we're trying to do here is we're trying to extend the hip, extend the knee, but hold on to that ankle dorsiflexion behavior, okay? Because naturally, when we extend the hip and extend the knee, the ankle will want to plantarflex or extend. That's that triple extension behavior in a proximal to distal manner. So hip extension, knee extension, and then ankle plantarflexion or ankle extension. Okay, it's the same thing. Here we're asking, can they maintain ankle dorsiflexion, foot pronation, and tibial flexion as we begin to extend the hip and the knee? Or do they quickly shift back into the heel via tibial extension or lose that medial foot contact? Okay. Or do they raise the heel too high off the ground? Because what we're going to do is we're going to challenge the isometric behavior of the distal plantar flexors here by hovering the heel just a few millimeters off the ground and trying to maintain that small hover off the ground here. Okay. So we'll bring this video up on the big screen for you. So we're going to bring the tibia into flexion first so we can facilitate that or pre-position that foot in pronation and the ankle in dorsiflexion. Okay. Then we're going to hover the heel slightly, maintain that slight heel hover. That's the key thing here. What you'll see in this video is a maintenance of that heel hover, but what you'll see in clients is a very quick lifting of that heel from the ground to try and facilitate ankle plantar flexion as the hip and the knee extends. What you don't want to see is this, where we begin to push through the forefoot and you see that quick tibial extension, where the foot will come back into, it will facilitate more of a supinated position. The weight will come back into the heel and we'll lose that forefoot contact. Okay, we want to try and maintain that forefoot contact to challenge the low capacity around the foot and the ankle in a more of an isometric manner as we extend the hip and the knee. So what we want to see is this. Can we maintain that tibial flexion, low through the forefoot, extend the knee and the hip? Obviously, there's going to be a little bit more of a prolonging of knee flexion here because we have to maintain tibial flexion to maintain ankle dorsiflexion. We're just looking to see, can we slow down that transition into supination? It will have to eventually occur to achieve full knee extension, but we're looking to see, can we slow down that, okay, or delay that transition into ankle plantar flexion and foot supination. So you'll see here that the heel is maintaining that slight hover position. We're maintaining that low through the forefoot. We're maintaining that slight dropping of the medial arch as we extend the hip and the knee. Okay, and you'll see that challenge around the foot and the ankle. Hopefully you can see how this is indirectly challenging the capacity to maintain foot pronation, because we're not directly moving the ankle into plantar flexion and dorsiflexion. So we're not directly perturbing the foot and ankle here. We're pre-positioning the foot and the ankle in dorsiflexion and pronation, and then challenging the knee and the hip. So we're challenging neighboring segments. Okay, we'll utilize this concept across the entire anatomy. So if someone lacks the ability to handle load while their lumbar spine remains flexed, for example, we can pre-position the spine in lumbar flexion and then challenge the lower limb. Okay, you might have seen that in a prior YouTube video as well. It's the same concept. We're indirectly perturbing the capacity to maintain a certain movement behavior. Okay, and it can be a challenging one for clients, but it can also, in some situations, be an easier strategy for clients to initially challenge a certain movement behavior. So if a client is struggling to manage loads around the foot and the ankle, maintaining isometric behavior at the foot and the ankle first can be much more easy to coordinate as we dynamically move the knee and the hip, versus if we went into more of a dynamic ankle movement, more of an isotonic muscular behavior around the foot and the ankle here to challenge the low capacity around the foot. It will be much more challenging for the client, we often find. Okay, so how might you directly perturb the foot and the ankle here? How might we perturb or slow down the movement into foot supination? Okay, thereby prolonging foot pronation even further. We can do that by elevating the metatarsal heads. We can do that by coming into more of a position of knee extension and hip extension, where we're standing up straight, where the only movement can occur is around the ankle joint. So we're concentrating movement around the ankle joint in more of a direct perturbation scenario. And then we can delay the supination of the foot. You might have seen that in prior videos as well, where we're trying to maintain toe flexion as we perform a calf raise. That will slow down the transition from pronation into supination. That will be more of a direct perturbation. Okay, but as you can consider, if someone's coming off a foot and ankle injury, sometimes concentrating that load around the foot and the ankle early on is too much too soon. It's too threatening for the client. It's too challenging for the client. That's why we like the concept of indirect perturbations, because it allows you to pre-position the local joint region in a position that you want to maintain, and then you challenge around that body region. Okay, so it might seem like a bit of a confusing concept, but once you understand the intent behind the exercise, you always have to understand the intent behind the drill or the strategy to understand why we're doing what we're doing here. Okay, so hopefully that's come across here. It can be, I can understand a little bit more of an advanced concept to understand, because it requires an understanding of segmental behaviors that will facilitate a certain behavior, in this case foot pronation, but it also requires an understanding of what segmental behaviors will challenge that. So what we're essentially doing is we're looking at what facilitates pronation, what facilitates supination, and we're taking a component of what can help facilitate supination and ankle plantarflexion, and then mixing that in with what can challenge foot pronation, because that can challenge foot pronation. We're taking the extension behavior of the knee and the hip, which will couple with ankle plantarflexion as we propel forward during gait, for example, and then mixing that in with foot pronation. So can we maintain foot pronation, ankle dorsiflexion as we begin to extend the knee and the hip without supinating or plantarflexing that ankle too quickly? Okay, so that's indirect perturbations, a little bit more of an advanced concept, but again, one of many strategies we can use to challenge the behavior around the local body region.